Hello, my name is Brian Bradley, and I'm the Vice President of Therapy Protocol at the Egoscue Method. We're going to be talking today about the Egoscue Method Tower and the boot that it comes with in regards to the supine groin progressive exercise. If you've purchased this tower, this will actually work as an informative piece to show you how to set yourself up to make sure you're getting the most out of that exercise. There's a definite functional reason why your therapist has prescribed this exercise to you. I'm going to have Liba set herself up into this Velcro boot. You're going to slip your foot through the Velcro opening, get your heel supported by the cup on the back, and then tighten up the Velcro across the top part of your foot. To set yourself up in supine groin progressive, we're going to have her left leg bent up over top of this chair, any chair that you might have in your house, that allows you a 90-degree angle. Let's have you scoot in just a little bit more. Good. And go ahead and lay back. Now let's have your hands down here at 45 degrees. In this position, we're going to allow her shoulders to settle down into the floor with her palms facing the ceiling. The importance of that is it changes her mid to upper back as the pelvis is going through the progressive changes that are going to happen to the different muscles in that area. Primarily the iliopsoas, or the primary hip flexor that comes from the femur to the pelvis and into the spine. That's a primary hip flexor that's going to have a slow passive release at each level. Do you feel like your low back, when we put you into this position, do you feel like it's arched up a little bit?
Yes, it is.
Okay, the longer it is arched up, the longer you stay. Because that tells us if your back is still arched, that means your hip has not let go yet. That muscle has not come to a functional length to allow the spinal attachments at the transverse processes in the bodies of the spine to actually drop to the floor. Keeping this leg relaxed, keeping this leg completely relaxed, your mid-back relaxed, and your upper back and shoulders relaxed, you're basically just lying in this position, waiting for changes. Do you have any discomfort, or does this actually feel pretty good?
This feels wonderful.
After all the work you've been doing, there's no question this is going to feel good. Keep your legs relaxed and your upper back relaxed. If you're unsure of why you were actually given this exercise by your Egoscue therapist, please contact them or email the Egoscue Method, and we'll try to get an answer out to you as soon as possible. Keeping this leg relaxed in your mid-back, are there any changes going on in your spine right now?
I think it's that arch is slowly decreasing, so my back is getting flatter to the floor.
Okay, it's not flat yet, and it will probably take about a minimum of 3 to 5 minutes to actually change per level. The longer the better, especially at the higher levels. If you're experiencing any plantar fasciitis or have acutely sprained your ankle, this exercise works very well because it packs the ankle to close to a 90-degree joint angle, which shortens the ligaments on the lateral portion and the medial portion of your ankle joint. The plantar fascia on the bottom of the foot and the soleus and the gastroc are under a lengthening in this position, so it actually, we found, has very good effects with people who have plantar foot pain. If you have a degenerative knee, you might not like this exercise while you're in it, but you're definitely going to like the exercise when you get out of it. You may start to feel like your knee is hyperextending, but all that is, it's a rotational mechanism coming out of your joint so that it's trying to realign your knee joint, and it's the first time that that's happened, probably in well over a decade if you're having degenerative symptoms there. Liba has bilateral, I think it's left more than right, degenerative hip pain. Keeping these legs relaxed, and she has a bone-on-bone in the acetabulum as it relates to where the femur head is sitting. So with that bone-on-bone, this is actually reestablishing and correcting the reason why someone actually degenerates their hip in the first place. It's teaching the femur bone how to work with the pelvic girdle bone, and it's creating a symbiotic relationship so that where they articulate, you're getting a congruent movement back and forth rather than just the leg bone tearing away at the cartilage. So this will be a real good exercise for her. Where do you feel your lower back is right now?
It's pretty flat to the floor.
Okay, we'll give it about 10 more seconds, 15 more seconds. Then I'm going to have you adjust it because in the clinic I can help you as a therapist, but at home you're pretty much by yourself. To get out of this position and switch to the next level, which is only about 4 inches lower, you're going to bend the knee and lift the foot up a little bit, and then you're going to maybe even lift your head, put it into the second level, and just drop it down. Okay? In that position, the tower, if it becomes movable, you can slide back a little bit. As it's going to feel when your leg is coming down, your leg might feel like it's getting a little longer. To make you a little bit more comfortable, you can slide back a little bit. Remember to keep your shoulders relaxed and your palms up as your lower back is settling at each level. Did your back arch up at this level?
Absolutely.
Okay. What I would do also is the way that you have yourself situated, if you can lift your head and look, your foot is slightly turned outward with this. So what I would do, create some inside pressure, good, now just relax, to slide the tower back toward you so that it actually creates an E version or closed pack version in that, or sensation in that ankle joint again. Those of you with neck and upper back symptoms, if you're getting an increased neck and upper back symptom from lying on your back, please contact your therapist because this exercise might have to be given to you at a later time. Keep this relaxed. Do you have any questions right now?
Can I prop my head if I'm getting some neck symptoms at the beginning?
Absolutely. You can put a little wedge underneath there or even a rolled up bath towel or something, not underneath your neck. We want it just under the base of your head so that it brings your cervical spine into not so much what we would call hyperextension, because that would tell us that your upper back is not changing position yet. And that's a good thing to talk about right now. As your upper back being so rounded because of the compensation that happens in your hips, you do a lot of work up here, and then your spine ends up in that rounded kyphotic position, which I'm sure many of you are actually subjected to on a daily basis. The more we sit, it rounds our upper back and shoulders over also. So when the shoulders relax down, that's also one of the ideas that we can actually try to feel for as the hip is releasing. So one of the direct effects is the actual lengthening of the psoas and the changing of the muscle length and tension around the front, back, left, and right sides of the hip. But the indirect relationship to the upper back is that your body's going to start extending in the mid-back. You'll get up straighter. Your head will be better aligned with your upper back. And so the ideal situation would be ankles, knees, hips, shoulders, and ear vertically lined above each other and straight across from each other, keeping your upper body relaxed. Now tell me about your lower back in relation to the floor.
It's about halfway back again into being flat.
Okay, just keep your upper body relaxed and just let this settle down. One thing I know that you're big on too is the abdominal breathing. When you breathe in with your stomach, you're actually triggering your diaphragm, which is the nerve that innervates the diaphragm comes from your cervical spine, 3, 4, and 5. So as you breathe in, your diaphragm actually descends into the abdominal area to make more room for the lung tissue to expand. And the fascia that actually is tied to the diaphragm is directly tied to the iliopsoas, the muscle that we're trying to lengthen. So what we're trying to do is as you move this diaphragm back and forth, we're going to get a slight lengthening and tension massaging motion to that psoas fascia and as it sits around the muscle itself. So it actually may help facilitate the release of that muscle. I think it's one of the major crucial components of this exercise is the abdominal breathing. Keep your upper body relaxed. You feel like you're able to keep your left leg relaxed? Or is there tension in it?
There's some tension in it.
Okay, stop that. Release that tension. Keep your upper back relaxed also. Okay? Now, I want you guys to really understand this. This isn't rocket science. So if your foot is making slight changes, if it's slightly turned out, or your upper back isn't in the right place, you're still going to get a huge benefit of doing this exercise. But every once in a while, it's a good idea to have somebody look at the pictures that you've been given and then be reassessed to see how we're doing. Let's have you drop your leg down a level. Now, do me a favor here. Put your leg in the lowest one. Tell me about your back in relation to the floor there. Okay, so now you as the consumer, what you can understand is this. If I can get you to lie down on your... Okay. If you lay down on the floor and you actually put your legs up over a chair like this, both legs, you're going to feel like your back is flat because you brought the knee and the femur closer to the hip, so you brought the primary hip flexor attachment closer to the other attachment at the spine. Now take the chair away, put your feet on the floor with your knees bent. In the hook lying position, you'll feel like there's a slight arch in your back because we've taken point A a little bit further away from point B. In this position, we've really taken away the lesser trochanter attachment much further away from the spinal attachment, but the muscle has not been fully released yet. We skipped 3 or 4 levels. So right now she feels like her back is really yanked up off the floor in reaction to that exercise, into that position. I don't recommend starting down on the floor. I recommend doing the progressive and allowing that muscle to become more supple as the weeks go along and the months go along. Remember, total health is cumulative, so if you can get this muscle to understand that statement by doing it day in and day out, you'll get a much bigger change out of your upper back, your mid back, and definitely in your low back. Your symptoms should start to abate based on your body becoming more balanced throughout the exercise.
So if I run out of time, rather than skip few positions, I should do a shorter time on each level?
A shorter time on each level, or maybe stay longer at maybe 3 or 4 different levels instead of 6 levels. You can maybe skip the second level and go to the third. It's better not to skip this at all. I actually found that some of my workouts with this exercise, I do 50 to 60 minutes per leg. And that's with 2 ACL reconstructions and slipped SI joint, and almost broke my back, and all these bicycle injuries and all that. I find that the more time I spend in this exercise, the longer lasting effects my other more active exercises give my body.
And I think you should also mention that if my foot keeps turning the tower this way, which is what you see all the time, that you can just put some weight in it to make sure that you keep it straight. And also watch for not putting the foot there like crooked into, you can also do it like this.
Yeah,
Make
she's
sure
actually offsetting the dowel.
That it's in the same slot on each side.
That's a great statement, because we see that all the time. People think that they're in the right place, but remember what I said. Pay attention to the little things, but it's not rocket science. You're getting benefit no matter what you're doing in this position. We'd much rather have you go from level to level to get the result you're looking for.
And if my hip gets really tight in this position when I make it all the way to the floor, do you want to go through the pain?
That's a great question, and that's very, our degenerative hip clients are always asking that question. What do they do at the last 2 or 3 levels when the hip becomes very painful? You know the difference between good pain and bad pain. If you're getting bad hip pain or back pain or sciatic symptoms from going to lower levels, don't go to the lower levels yet. What's happening is your leg is actually dropping. Your pelvis is not reacting. So you're actually doing the same thing. You're just digging that femur head into the joint, bone on bone. We've got to reestablish that the pelvis is a movable entity above the movable femur. Once we can get a good congruent movement and articulation there, problem is solved. But if you have pain at the bottom 2 or 3 levels, that's when you can actually just skip them and switch to the other side. Maybe just spend longer times at the upper levels. All right, well, if you have any questions, please feel free to call us. It's 1-800-995-8434, and we'll get a therapist to you as soon as possible. Thank you very much.